Hello, everyone. My name is Jarrett David, and today I will be presenting my Nursing 456 Senior Practicum project, which involves improving multi-departmental care coordination communication. This project's initiative was aimed at enhancing the nursing department's interdisciplinary communication. I will be discussing the project's goals, objectives, implementation, outcomes, and its lifelong learning experience. To fully understand the scope of the project, you must first have some background knowledge of the facility I work for. The Barry Robinson Center is a residential facility that treats children and adolescents that have been diagnosed with behavioral and/or mental health disorders. In this facility, patients live here for a time period of 5 to 9 months where they are provided with daily meals, education, therapy, and recreational activities. During their stay, many departments play a role in their care and treatment plan. Of course, we have the nursing department that administers medication and tend to their medical needs, but we also have other various departments such as clinical therapy, residential, and department leaders who play a significant role in patient care. In this facility, it is integral that each department is on the same page, sharing valuable patient information to help coordinate effective treatment. Due to this, I wanted to create a new method, a method that would enhance the communication between the nursing department and the other departments to help improve patient care coordination. To start off this project, the planning phase was an important part in creating a new method of care coordination communication. I conducted interviews with various nurses, therapists, staff, and department leaders. It became evident that the communication between the departments could have been greatly improved. I created a new method of care coordination communication by creating a nursing report template with pertinent medical information that would be updated daily. The information on the nursing template served vital to the treatment of each patient. This template would be sent out to various members of the treatment team via email by our nurses nightly to ensure that each member is made aware of any medical changes in the patients. This method allowed for a more efficient and prompt way of information sharing. This method was implemented for a 10-day trial on the unit, and a satisfaction survey was conducted at the end of the trial to assess the satisfaction of each participant and to measure the success of the new method. The main goal of this project was to improve the communication between the nursing department and other departments involved in patient care. This includes the nurses, psychiatrists, clinical therapists, residential staff, and department leaders. To achieve this goal, a structured encrypted daily nursing report was introduced. By the end of the implementation process of this project, it became apparent that the new method improved the communication between the departments. Participants were made aware daily of any new medical changes and increased efficiency in interdisciplinary care coordination. The nurses also expressed an improvement of documentation errors and communication gaps. Department leaders cited that the new method increased interdisciplinary collaboration. This new method aimed to meet a number of primary objectives that could help improve patient care and patient outcomes. An integral objective for this project was brainstorming and creating a new method in improving interdepartmental care coordination communication. This method must follow facility policies and be a tool that would be useful to the nursing department as well as beneficial for other departments. Once this method was created, the next objective to complete was the implementation process. This implementation phase occurred for a period of 10 days. During the trial period, I received early feedback from participants, which helped further improve the new method. This improved method allowed for a more efficient process of delivering important medical updates. In addition, it helped move the nursing department to a more electronic-based reporting system. Throughout this whole project, many learning strategies were completed. One very important learning strategy early on in this process was related to interviewing staff and department leaders to identify specific communication gaps. Based on their insights, a new electronic daily nursing report was created to help improve prompt and efficient information sharing. This new nursing report was intended to keep the treatment team aware of any updates that occurred during the shift. With the new reporting process, a training guide was created to all participants to better understand the new methods process. A 10-day trial period was conducted and feedback was collected via satisfaction survey to assess the success and satisfaction of this communication system. Based on staff input, adjustments were made to improve the usability and clarity of the new daily nursing report process. The satisfaction survey served as a vital tool in further improving the new method of care coordination communication. Once each participant completed the satisfaction survey and provided feedback, analyzing the data was essential in determining if the new method was successful. When analyzing the results, it was evident that the new method of care coordination communication was a success. All participants provided positive feedback of the new method, citing an improvement in interdepartmental communication. In the nursing department, the new method helped move the department to a more electronic-based reporting system. It also helped improve any communication gaps during shift change. Participating nurses stated that the new method helped streamline the documentation of medical changes, as well as provide an efficient and prompt method of communication. Nursing department leaders stated that this new method increased multi-departmental collaboration. All participating nurses also expressed that the new method should be used facility-wide. This project has shown that a simple change can have a huge impact on a nursing unit and other facility departments. The real-world application of this project helped improve an area that needed to be revamped. This new method provided practical use in daily nursing workflow and reporting. It also helped enhance nursing education on communication strategies. Nurses reported early on that the lack of inclusive communication was a major barrier to continuity of care. This method improved that concern. The satisfaction survey and feedback system allows for continuous improvement. Even though this method seems simple, the foundation of this method was based on evidence-based practices from peer-reviewed literature. An inclusive method of communication among healthcare staff achieves increased positive patient outcomes. The completion of this project has helped reinforce and enhance new leadership and problem-solving skills. It is the first quality improvement project as a nurse in my career and has taught me many invaluable lessons. This method not only helped the nursing unit improve the quality of patient care, but positively affect other major departments. It helped me learn the true importance of multi-departmental communication and the continuity of care. This project helped further develop my strategic thinking and implement new processes as a leader. This learning experience helped with accepting feedback, whether positive or negative, and having the willingness to continuously improve. The first-hand experience has helped me grow as a nurse and further improve as a nurse leader. Thank you for your time and your interest in my Senior Practicum project. Here is a list of references I have used throughout this project, all being such an invaluable resource.